Hello, thank you so much for joining me today.
You're very welcome. It's an honor. I'm so proud of you. You're raising a great cause here, raising awareness for a great cause here.
Thank you so much. Would you like to start off by introducing yourself before we get started?
Absolutely. My name is Kirti Jain. I'm a primary care physician in Downriver area, and I have a special passion for mental health.
That's incredible. We thank you so much for taking time out of your very busy schedule to join me in this quick interview. Um, the first thing I want to ask you about is, as you mentioned, you're a family doctor. So, from your experience being a family doctor as well as a parent in the South Asian or Indian community, what mental health challenges do you see most prevalent among the Asian youth that you think might be uniquely influenced by cultural factors?
Absolutely. Great question. It's something that's really close to my heart. So when you asked the question, remember we talked about South Asian community. And South Asian communities uniquely positioned to put all the stresses on the children because there are only 5.4 million South Asians in America, but they are the most highly economically successful population in the country. They are all highly educated. Minimum is even bachelor's degree, 75% of us hold. So mental health is a very stigmatized topic. And rather than seeking help, individuals and the parents, they like to struggle in silence. They do not want to talk about because of the cultural issue. The culture is such that if you have mental health, you are weak, you have done some sins, you are not disciplined. So, because of such a culture, it stays underreported and it's a stigmatized topic.
How do you think that cultural values, like as you mentioned, academic success or maybe even family reputation, could affect how young people in this community express stress or ask for help?
So, because of these issues, young people in the community, they suffer in silence. Like I said, it gets highly underreported or untreated, and it can lead to bigger issues later in life because family wants to protect their honor, um, their pride, and they do not want to look weak. So the kids are not often validated in their feelings of mental health, and this remains highly underreported, untreated, or undertreated issue.
Yeah, and I see that very commonly also. Many parents they want to help their kids, but they don't always know what to look for, right? So what do you think are some big signs that a child might be struggling with their mental health that a parent should be looking out for?
So, some of the symptoms are straightforward that are classic depression symptoms that a child is losing interest in doing things, child is not doing things that he used to enjoy, child is always feeling like he's a failure to himself or to their community or to their parents. But there are also some non-psychological symptoms, which means there are somatic symptoms, there are physical symptoms. Child might be having issues of sleep disorders, eating disorders, unusual headaches that are not accounted for, unusual abdominal pains. So parents have to be really vigilant and pay attention to these symptoms.
Yeah, and I think that's what a lot of parents sometimes miss. And it's oftentimes not because they don't care, but because they don't know what to look for. And they're trying to do what's best for their children, but sometimes those signs just they aren't obvious.
Because they think child is just being rude if the child is not showing interest in activities that he used to do, or he's not being extremely social or not talkative. Parents believe that child is being selfish or not disciplined or rude. So, awareness is important. Parents should be looking for signs of depression.
Exactly. And you kind of mentioned this a little bit, but what do you think drives that stigma around mental health in the South Asian communities? And Also, what do you think we could do to help reduce it?
Absolutely. There are multiple factors. Actually, there are several reasons we have this issue. First, we like talked about we have to maintain our family honor. South Asians believe in having our own dignity and reputation. And if we talk about mental health, we might feel that we are ruining our family honor. This is also because we are community based people. We call it collectivism versus individualism. So we are generally seen in community. And if we try to seek help, we are feeling selfish. We are supposed to take care of it within ourselves and not seek help outside the family or friend circle. The traditional beliefs are that these mental health things are because of self control is lacking, because the child is not disciplined, because they've done some sin. If certain psychotic features in India, people used to think that this is some kind of sin and God is punishing them. So, unfortunately, our traditional system, the belief system, does not help. Then the stereotype of Asian Americans are typically successful and highly high achievers. So that pressure on the kids, that also is an issue. Um, and then most important thing is lack of mental health education in parents itself. So that doesn't help.
Another question I have is if a parent wants to start an open conversation about mental health in their household, but feels uncomfortable maybe or unsure, what's a good first step that they can take?
So in general, having a communication issue is an issue for all of us South Asian community. There is a framework called TALK. T stands for topic, A stands for asking question, L for levity, and K is for kindness. So this applies to any conversation anywhere. However, in this particular issue, we have to have open conversation. We have to have uncontrolled support system. We have to start with casual bonding with child before asking tough questions. We have to start with I question instead of you question. If the child is not behaving, instead of saying, why are you doing this? Why are you not doing this? We can start with questions like, I'm noticing you are feeling certain way. I believe that this is what is happening. That helps a child. And sometimes it's okay if child does not want to talk. We have to be patient, we have to be understanding, and we have to accept radically what child is going through and validate the feelings.
And before we were speaking today, you mentioned both supportive listening and also trying to immediately fix the issue. And so, what do you think is the difference between those two, and how can parents find a balance? Because I think both of them are pretty important.
Absolutely. Both of them are important, but one is supporting growth mindset, other one is fixed mindset. If you tell your child you are smart and you can do everything, or you are not smart and you will never be able to do it, you are discouraging the child. If you support growth mindset and you suggest the child is able to do it, he can develop any abilities and you encourage them. Your question is about supportive listening. When you have a child and he's coming home with a crisis, we need to be able to validate the feelings instead of jumping to fix the problem. That's what most of us want to do. Sometimes child wants to be heard, he wants to be seen, he wants to be listened to. Having active conversation style, listen to child, not be on your phone, not be busy with your housework and have a back towards child when he's talking about something important. These are little things that we often miss and not understand, but validation and not judging is important.
I 100% agree with that. And I think that really resonates too, because I know for me and a lot of my friends, We sometimes wish that our parents would just listen without immediately trying to fix us or compare us to others, because that's also a really big thing in the South Asian community. We're always being compared to our friends or our cousins or other people because our parents want us to be successful, and they're doing it out of a good heart, but sometimes it doesn't always do that.
And I was going to give you an example of validation because most of the time, you kids are smart and you know the answer, you know the solution. You do not need the answer, you just need to be heard. So, the example that we were taught when we were going through these lessons, that there is a family room, and this is a story where the husband and wife, they are in the family room. Husband is just walking in from work and wife is sitting on the couch with actual metal nails sticking out of her head. And husband is asking wife, "Hi honey, how was your day?" Wife says, "Oh, I have severe headache." And they pause the video and they ask all of us, "So what should the husband do?" And all of us jump to conclusion thinking, clearly remove the nail from her head because that's the cause of headache. So the question remains, like, do you think the lady does not know that this nail is causing headache? No, she wants to be validated that yes, you have headache. She knows to remove it and she will take care of it. However, for now, what she's looking for is somebody to understand her feeling and validate it. So it's really difficult, but parents need to try and get to that point instead of jumping to fix the problem.
That's actually a really, really good example that you gave. I think that's very powerful. Going back to the talk about high achievement, again, being academically successful is extremely important. But how can parents kind of create a balance between encouraging achievement and also maintaining high expectations while prioritizing their child's mental well-being?
So this is the same thing that I was talking about earlier, that promoting growth mindset, promoting child's abilities and nurturing what he's interested in instead of burdening him with parents' expectations and aspirations, setting realistic goals, celebrating efforts over outcomes, fostering a supportive home environment, teaching coping mechanism, teaching mindfulness, yoga, meditation, physical activity that helps with the stress, and then healthy habits, sleep, nutrition, exercise. Basically, parents also need to be a positive role model for children. Every transaction a parent has with their child that leaves some kind of impact on their head. Instead of telling them what to do, they need to model it themselves too.
And that's a big concept in psychology too, called modeling, where a kid will directly follow their parents because they're seen as higher authority. That's the only person at that age they know to trust, to listen to. But at what point do you think parents should consider seeking professional help versus trying to handle things within the family?
Right. It depends on the level of severity of issues. Sometimes there are few tough patches, rough patches in life, and you can talk it over and you can come out of it. But if a child's emotional and behavioral issues persist, they're intense, they're disruptive to their daily life or school performance or sleep at night, they're aggressive, their moods are switching from totally normal to totally abnormal. And most important is they are talking about self harming or harming others. Depending on the severity, if things are that severe, then they need to get psychiatric help. They need to go take care of it through their primary care or a psychiatrist. They need professional help. Sometimes we may have to call crisis hotline and take the child to emergency room. So it depends on the severity of situation.
Yeah, and before we wrap this up, I want to talk a little bit about the future. And so, what changes do you hope to see in the way that Asian families or South Asian families approach mental health over maybe, let's say, the next few years?
So I believe that first of all is we all have to have open dialogue and not stigmatize this issue. We have to treat it like any other health problem. If somebody has broken leg, we don't feel ashamed to talk about it. This is also an illness and not stigmatized it. Second thing is redefining success beyond just trophies and having good careers. The kids need to be encouraged in any effort that they're doing and what is their personal best. That will prevent the mental stress and burden and issues like mental health. And then using culturally sensitive issues like things like you're taking child to meditation or religious practices if that helps. We also can take children to places where they can help other people and that gives them positive self image if they're going to a nursing home or a assisted living facility where they're helping people who are in need. That helps child's self confidence and they feel good about themselves. That's one way to make them feel better also. But most important is education for parents so then they don't struggle themselves. And if the child needs help, they can identify it before it's too late and they can seek some help.
Yes, for sure. And last thing before we wrap up, for any parents who may be watching this interview, if they could just do one thing differently starting today, what would you suggest that be?
Unconditional support. It's actually to validate your child and have unconditional support, unconditional love for your child.
How
Never
about
judgment.
yeah, exactly. And how about other practices like maybe yoga, exercise, meditation?
These are coping skills. Absolutely. Yoga, meditation, and breathing techniques definitely help. And that will also help if parents are doing it themselves. So, if we talked about it in the past, that if we are in a plane and the flight attendant comes and explains to us in case of emergency, put your own oxygen mask first before helping your dependent child or older parent. Same way with our children. We cannot help anybody if we are not helped ourselves, if we are not mentally strong and stable. So, first, help ourselves. The parents should be doing things to help their mental health. That means taking time out for themselves, doing meditation, doing yoga, doing physical activity, taking care of their nutrition, taking care of their sleep, which is what we were talking about a few minutes ago about good modeling. They are good role model that will help child. But mental health and physical health are often connected and they go hand in hand most of the time. For most, when we say mental health, it's a huge topic. So there are some mental conditions that you can genetically predispose to and you can have it no matter how fit you are. Yet, so many mental illnesses get better by exercising. When you exercise, you release something called brain derived neurotropic factor, and that helps your mental health. You release endorphin, that gives you uh, feeling of well-being and it lasts and it these are the effects that you see immediately. When you exercise to lose weight, you might not see the results for 6 months or 12 months, but release of endorphin immediately after exercise, you notice it is unbelievably good for people to do exercise, mindfulness, meditation, yoga. So these are the things parents have to do themselves so children can copy and notice and utilize it, even though they may not do it right that moment or that day or that month. But somewhere you're leaving a mark in your child's brain and they will follow, they will come back to it.
Yeah, I think that's really powerful. And everything that you have mentioned today has been very insightful and very valuable information that I think everyone can learn something from. Um, I do really thank you for your time. Is there anything else that you would like to add, though, before we wrap this up?
I just want to applaud your whole effort of taking care of this particular topic. I'm really, really proud of you at this such young age. You are so mature beyond your years. So please, all the best. Keep up the good work and let me know if I can be of any help.
Thank you so much. We really appreciate it. And I hope
All
we
the
can
best.
connect sometime in the future.
Absolutely. Anytime.